Hi, I'm Desiree. The topic that I'm going to be talking about today is breast cancer. So what is cancer? Cancer is a group of diseases that cause the cells in the body to transform and proliferate and grow out of control, and eventually it forms a mass called a tumor. Tumors are named after the part of the body that originates from, so breast cancer is a tumor that started out in the breast, and tumors can be non-cancerous, which is called benign, or cancerous. So breast cancer specifically is a group of adenocarcinomas that have originated in the epithelial part of the breast tissue. And breast tissue is made up of fatty, connective, and lymphatic tissues and glands for milk production. So there's lobules which produce the milk, and then the ducts which connect the lobules to the nipple, which brings it out for when you need it. So there's two different categories of breast cancer. There's non-invasive and invasive. Non-invasive is the less serious of the two. Non-invasive breast cancers are called in situ, so that means that it is situated, which means that it has not metastasized or traveled past the part where it originated. So ductal carcinomas are carcinomas that originate in the cells that line the milk ducts. They have not spread past the breast tissue or throughout the body, and ductal carcinoma is the most common type. Then there is lobular carcinoma in situ, which originates in the lobules, and it also has not spread past the walls. Typically, LCIS is not considered a true cancer. However, it is an uncommon condition, and when it is diagnosed, it can lead to a greater problem and increase your risk for developing invasive breast cancer. It's also important to note that if a non-invasive breast cancer is left untreated, it can grow, metastasize, and develop into an invasive breast cancer, which means that it has grown and spread past your breast tissue. So invasive breast cancers, there are invasive ductal carcinomas, which originates in the ductal lining and has spread to the nearby breast tissue. This can metastasize throughout the body. And then invasive lobular carcinoma, which originates in the lobules and has spread to the nearby tissues. And about 1 in 10 women diagnosed with breast cancer is actually diagnosed with invasive lobular carcinoma. Another type of breast cancer, invasive breast cancer, is inflammatory breast cancer, and inflammatory breast cancer is very complex. It doesn't manifest into a tumor. It's actually a cancerous block in the lymphatic vessels in the breast tissue, which causes inflammation. So in a typical mammogram, it's not typically found. So when inflammatory breast cancer is found, often it is too late because it has spread. And those types of breast cancers aren't the end-all be-all. Breast cancer is very complex. There are different types and subtypes. However, those are the most common. So for epidemiology, there are several risk factors that put you at risk for developing breast cancer, and unfortunately, you cannot prevent breast cancer. However, if you do know that you are in a higher risk category, you can take the steps to ensure that you're getting checked out frequently and are doing self-exams to make sure that you notice changes in the body before it can develop to something more serious. So the elderly group of people are more at risk for developing breast cancer. And then females are more susceptible to developing breast cancer. However, it is important to note that males can also develop breast cancer. Males also have breast tissue, so that can lead to a development of breast cancer. Your geographical area or socioeconomic status. People in a lower economic status have a harder time getting access to health care, which can lead to having a cancer metastasize and not being able to get treatment to treat it. So age at menarche, which is a first menstruation. Higher risk category is age 11. Postmenopausal women, so that's after age 54. And then the time you have your first pregnancy. So women after age 30 have riskier pregnancies, and if you have your first pregnancy after age 30, that makes you more at risk for developing breast cancer, and after age 35, that puts you at a super high risk. Family history, so that if you have a family member like your mother who, if she was diagnosed with breast cancer before age 40, you have a higher risk of developing breast cancer yourself. Typically, family history counts for your first degree relative. And then if you have a previous benign disease, so a benign tumor in the breast, or a non-invasive breast cancer. And then also Diet and body weight is another risk factor. Obese and overweight women or sedentary women are at more risk of developing breast cancer than someone who's active. So the pathophysiology for breast cancer is extremely complex. It starts out with a disruptor, so a hormone, genetic mutation, and things like that can disrupt normal growth and regulation. So first is estrogen and progesterone. Typically, they enter the cell, they bind to their receptors, and do what they need to do in the body. However, if you have a mutation on estrogen receptor alpha, estrogen receptor beta, or progesterone receptor, this is what can cause problems. If estrogen binds to a mutated receptor, that can lead to a disruptive growth, and that's when it starts to grow out of control, and that's when tumors can start to develop. Another receptor is human epidermal growth factor receptor 2. This has been shown to form within the cell membranes of malignant breast tumors, and this can lead to rapid tumor growth as well. And then inherited genetic mutations, BRCA1 and BRCA2. I'll talk about that a little more in the next slide. You can inherit a genetic mutation in these genes, and when it is present, it does not suppress the factors in your body that kill cancerous tumors. And then other acquired genetic mutations can be acquired from exposure to radiation or other chemicals throughout your lifetime. So BRCA1 and 2, about 5 to 10 cancer cases are related to with a mutation inherited from this gene. And women who have this gene are at a 50 to 80% chance of developing breast cancer. So BRCA1 is a DNA damage repair protein, and BRCA2 is a tumor suppression gene. When they are not mutated, they do their job and fight the tumors from growing and stop cancerous cells from producing. However, if you have a mutation in this gene, that is when things start to get out of control and that it cannot fight off the cancerous cells. So this is just a small graphic summarizing what I just talked about. So signs and symptoms. The most common symptom is the formation of a new mass. Painless hard masses with irregular edges are typically cancerous, and you can also find in a regular exam a painful, tender, or soft mass, which is typically non-cancerous. However, that is still a cause for concern, and it still should be checked out. Swelling in all or part of your breast, skin irritation or dimpling in the breast nipple or pain, nipple retraction, redness, scaling, or thickening of the nipple or breast skin, and discharge from the nipple. So this is a very important graphic. It's very important for women to start doing self-examinations in their 20s. So this just summarizes how you can do an at-home self-breast examination. And if you are examining yourself regularly, it's easier to notice a change. So if you do notice a change, that's when you can go to the doctor, talk about it, and that's how breast cancer is found early. So diagnosis, typically it's diagnosed through a routine clinical exam or a self-exam. Every year, women usually go to the gynecologist, and that's where you get your mammogram done. Mammograms are detecting calcifications, small tumors, and non-palpable lesions. And then ultrasounds are detecting fluid-filled lesions or smaller tumors in the breast. And ultrasound is looking at dense breast tissue. So when you go to the doctor and you get a mammogram or ultrasound done and something is suspicious, that's when you move on to the next step, which is a biopsy or a fine needle aspiration. So this is performed usually with a needle or just a small incision. That's when they take out the suspicious tissue or tumor and take it to a pathology lab where they examine it. So if it turns out to be cancerous, it will be graded to a healthy tissue sample, and it's graded through grade 1 and 3, and then it is also staged using the T&M system. So this is a graphic showing how the different biopsies and tests are performed. So that's a core needle biopsy, an ultrasound with a fine needle aspiration, a regular ultrasound, and a mammogram. So T and M staging distinguishes the cancer in T, N, and M stages. T is a number from 0 to 4, which indicates the tumor size, and then N is a number, and then a number 0 to 3 indicates that the cancer has reached the lymph nodes and the number of lymph nodes infected, and M is a number from 0 to 1, determining if the cancer has spread or metastasized. This is a graphic showing different breast tumors and different stages and how the T, the N, the M stages work and how it goes from stage 1 through 5, and then T, N, and M. So there are many treatment options. You can do hormone therapy, which blocks estrogen attaching to the damaged and estrogen receptors, aromatase inhibitors, which block enzyme actions, and then there's hormone therapies that can block the actual cancer receptors, and then targeted therapy, which attacks specific abnormalities. There's also radiation therapy, which is done in the early stages, which targets direct cells, and then chemotherapy, which is a cocktail of cytotoxic drugs, and that's usually given before surgery to shrink the tumor or post-surgery to prevent relapse. Different types of surgeries. There's breast conserving surgery, which only a portion of the breast containing cancer is removed. A mastectomy, which the entire breast tissue is removed. Lymph node biopsy, which is a removal of the lymph node, or breast reconstruction, which is done after any of these surgeries to bring the breast back to normal before surgery. So this is research done on the effect of exercise on breast cancer. So to summarize this, women who were more active have a better prognosis post breast cancer and have a lower chance of recurrence. And so it's just 30 minutes of brisk walking 5 days a week can drop it down to a 50% chance of recurrence. So my case study is on a woman named Julie Cooper. This is fictional. A 55-year-old woman, unemployed, active in the community. These are her vitals. She's active. She had 3 children. She was diagnosed with breast cancer at age 54, and her mother has died from breast cancer at age 67. So this is her breast cancer history. It wasn't very serious. It was something small. She found it early. She seeked out treatment, got chemotherapy, and 33 rounds of radiation therapy, and she is currently 12 months post-surgery treatment and is currently cancer-free. So I would put her at a low risk. She does not have any cardiovascular risks, pulmonary risk, metabolic disease, no signs or symptoms, no cardiovascular risk factors. I would put her at low risk. However, take special considerations because she did receive surgery, and she could be at risk for lymphedema, risk of fracture, immune function, and chemotherapy can also weaken the bones, which make you more susceptible to a fracture. So exercise testing that would be done on her would be pulmonary function testing to just test her pulmonary function post-chemotherapy, and then a maximal oxygen consumption test to test her VO2 max, check her EKG, make sure her heart is functioning properly, and a 1RM upper body and lower body to determine her baseline. So this would be the prescription that I would give her, just 3 to 5 days a week, moderate intensity to just stay active, and then a resistance training program, 2 to 3 days a week, free weights. She did not have her lymph nodes removed, so she really is not at that high of a risk for lymphedema. However, it is important to tell her that she should not be lifting too much in her upper body to, focus more on lower body. And staying active will help her, reach her goals, improve her physical function and activity, improve her quality of life, and reduce her chance of cancer reoccurring. And it can also reduce the negative side effects of cancer treatment. So that is the end, and thank you.